Okay, well, today we are thrilled to have both Lori Zachary and Lisa Campbell on with us, and we're going to be doing a unique connection between our donor who supplies donated medical supplies and equipment to Matter, and then also one of our receiving partners that is on the ground and can really explain how these supplies are utilized. So to begin with, I'd like to introduce Lisa Campbell. Lisa is Director of Purchase Services Contracting at Unity Point Health, and also Lori Zachary. She is with Real Hope for Haiti, and also one of our volunteers at Matter that does just a huge amount of sorting of supplies. So we appreciate that. So today I'd like to just ask a few questions and have your responses so we can get to know really both organizations and some of the motivations about why you do this. So I think we'll start with you, Lisa, first. I guess, we've been working together at Matter for a few years, I think. It's been probably close to 3, I think.
I think it's a little over 3, actually.
Yeah, boy, time flies.
It does, I know.
I can tell it in my face right now. It's like the years go very quickly. Why is it important for Unity Point Health to really invest all this time and energy to repurpose medical supplies?
So we're in 3 states. So we're in Illinois, Wisconsin, and Iowa, and our main distribution hub is in Des Moines. So one of the things that we've done is we've worked with Owens & Minor and Lube Tech to create this nice operational way of bringing back all of those supplies and equipment from all of our hospitals. So we have hospitals all over the 3 states. What we've done is, and it's kind of been a word of mouth, and so I work with the supply chain leaders, and they work with all of their staff to say, hey, we partner with Matter. If there are things that you want to repurpose or get rid of, or things that might have expired, all of those things we can put out on the dock. And when the trucks come, as long as it says Matter and it's clearly labeled, they will pick those up and bring them back to the distribution center. So everyone at Unity Point knows that we have this partnership. And so it's in the back of their minds of what can we do? What can we do to assist? And what are some stuff that's, maybe we're going to throw away and that might go into the landfill? It's a no-brainer. Put it down on the dock, and Owens & Minor truck, as long as it's clearly labeled, we'll bring it back. They'll put it on that semi that sits at Owens & Minor until Lube Tech picks it up and brings it back to you guys. So it's a really easy, wonderful way. And people just love it. They'll send me notes all the time. Hey, do you think Matter will be interested in this? Will they be interested in that? And so I'll just send a message to you, Joel. How many times do you get a message from me? Hey, do you guys want these beds? Do you want these incubators? And it's like, yeah.
Exactly. Oh, Lisa, thanks for that. I'm so glad you mentioned Owens & Minor and Lube Tech. Because to make something beautiful happen requires a teamwork, and
right.
Lube Tech sending the trucks whenever we need them, and bringing in these supplies and equipment, then Owens & Minor for being so easy to work with,
right?
Saving these, so it's wonderful teamwork. So, okay, one last question for you, Lisa. What would you say is the biggest benefit for Unity Point Health to work with Matter?
So there's a couple of things, but I think the most important thing, and the thing that I think of every day, is we want to make a difference in people's lives. We want to make a difference in people's lives all over the world. And we feel like we've got this reach in Iowa, Illinois, and Wisconsin, but we want to touch more lives than that. It's really important for us, and specifically for me, this is so important work that we do, being able to help organizations like Matter with things that would just go into the landfill, or maybe we'd have to pay to get hauled away. It makes perfect sense to partner with someone. It's a wonderful relationship. And for me, I think Unity Point, the whole vision and purpose of us is to show how much you matter, and what better way can we do that with partnering with Matter?
Oh, it's beautiful. Thank you for that, Lisa.
You bet.
Lori, representing Real Hope for Haiti, it's interesting. I think this is unique in that as we talk about where this comes from. So Lisa's described where all these supplies originate from and coming through Matter and then going to the field. And I know over the years, Lori, there's been pallets and pallets of supplies that have gone to some very needy areas. And I can say that the majority of that comes from Unity Point Health, one of our largest donating partners. So to kind of get us to understand how this all works together, the final piece of the puzzle, getting right on the ground, how essential is it for these supplies that flow through Matter from Unity Point Health? How essential is that to your work in Haiti?
Critical. At this point, we now use Matter supplies every single day. They have now been incorporated into our inventory, and there isn't a day that goes by that we don't use them. Numerous items that you have given to us, like nasal cannules pediatric nasal cannules are really hard to get in Haiti. Good IV 24 gauge IV casts are really hard to get. Wound care, gauze. I mean, there's been times where we have used cabbage leaves as gauze because we had none. We would tear old sheets up for bandages. We'd use paper towel and toilet paper. And over the last few years, because of the disruption in Haiti, COVID didn't help. We were at times out of gloves. We would recycle them. We would wash them. We would use a mask for a week and clean it in the oven. And recently in March, I believe, a shipment came in. And so now we are restocked again. And it is a morale booster for our staff to know that they have the tools that they need to provide the care that everybody deserves. A couple weeks ago, I was talking to my stepdaughter, Lori, and she said she had the worst day she's had and she can't even remember when. And for her to say that, I knew it was a bad day. She had had a gunshot. She had had somebody with anthrax. She had somebody with AIDS. She had 2 men that came in that had been fighting with machetes. And she said that was just the tip of the wound care that she was dealing with that day. And she goes, had it not been for Matter and the gloves and the gauze and the sutures that you sent in to us, she goes, I couldn't have done what I did. I can do a lot of things, but I can't care for Haitians if I don't have the medical supplies. And for the first time in their 25 years that they've been in Haiti, they now have an adequate supply of items in order to care for everybody that comes in. And that includes all the, approximately 40 children in our rescue center that are fighting for their life from malnutrition. So they have pediatric oxygen tubing, and you sent me a couple O2 machines. We never have enough of those. And so it has really changed the entire atmosphere within the medical clinic and the rescue center. It has boosted morale. And everybody feels like they're valued, like somebody in the States really appreciates what they're doing and supports them. And it's encouraging because, days are really tough in Haiti when you see children dying quite often and you feel helpless that you can't help them.
And Joel, this is Lisa. That's exactly why we do what we do. I mean, the stories that we hear, and a lot of times what I'll do is when somebody wants to donate, some equipment, or they're like, hey, will Matter take this? And what I do is I'll send them links to some of the articles that you post so they know exactly where it's going. Because just what you're talking about, that's exactly what matters to us. We want to make a difference. And the fact that we can make just a little difference, and that I think in this country, we take that kind of medical care for granted in a lot of cases. And so just being able to help any little bit that we can is huge for us. And I love hearing this story because it just makes all the work, because it's so easy for us. It's not at all hard work just to put some stuff on a dock and send it back to Owens and Minor, and being able to, just make any difference at all is just so important to us. It just warms my heart. And I know Unity Point loves this work.
Yeah. Wow. Yeah. I tell you, I think Lori, I think you have the message from Lisa and myself. It's a morale booster for us. I mean,
Yeah,
this is
absolutely.
this is what makes our day, our week, our month. So
Yeah.
We appreciate that.
Yeah, it actually could also make me bawl my eyes out because it's so, I mean, it's unbelievable to think about how healthcare is in some other countries and how for granted we take it. And it's overwhelming.
Yeah.
I'm overwhelmed with gratitude and so happy that we can make a difference at all.
That's great. That's great. Well, to wrap this up, I would like to just ask Lori for a short story, an example of how the supplies that have been sent have saved a life. Can you give us an example of that?
Yeah, I ask Lori for stories all the time, and then I share them with different partners. And so she sent me one the other day, so I'm gonna read it to you because her words are better than mine. And it starts out, about 2 weeks ago, Nahemi, a 2-year-old boy suffering from seizures, was brought to the clinic by his father. While he didn't have a seizure in front of us, we started Nahemi on meds and told his dad to bring him to the clinic immediately if he had another seizure. In the meantime, we were trying to get him an appointment with a neurologist. 4 days later, Dad left to run an errand and Mom was caring for Nahemi. He started having seizures and Mom just froze, not knowing what to do. She called Dad and waited for him to come home. By the time Nahemi was brought to the clinic, he had been seizing for over an hour. We had an ER bed ready for him with a drape and chucks pads. His O2 was low, and we immediately grabbed PEDS oxygen tubing and tape to put him on oxygen. We used a wraparound probe on his toe to monitor his heart rate and oxygen levels. We used gloves, IV, 24 gauge, angiocaths, tegaderm, tape, gauze, IV, locking tubing, and hub. Syringes and alcohol pads to start an IV with seizure meds. His O2 came up and his seizures calmed a bit. He had aspirated phlegm and secretions, and his lungs were very wet. Just when we thought he might be slightly improving, he took a turn for the worse, stopped breathing, and died. His heart rate and breathing stopped for 2 minutes. 2 staff was performing CPR. 1 staff was dealing with the hysterical family. Another staff was grabbing a suction machine out of a storage. We used suction and tubing to pull out secretions from his airways in an ambu bag to give him breath as we continued CPR. He got a faint heartbeat and then started breathing, although very randomly at first. Suction was continued to help him open his airway. He did not regain consciousness, and we were worried about continued seizures, brain damage, and aspiration pneumonia. He was transported to a larger hospital where he spent the night, but was released the next morning. When he came to see us that afternoon, he was walking, although very shaky and weak. The parents are still nervous about his progress, but thankful he was alive. He is following up with a neurologist. And then Lori says, Matter Supplies saved his life. We couldn't have done anything for him without these supplies. And the thing about this whole story is the ambu bag, and they come through Matter all the time. And I think to myself, wow, we're out in the middle of the mountains in nowhere. What's an ambu bag going to do? But I started sending them to her, especially the PEDS ones. And I know that this ambu bag came from you. In fact, every single supply on here is what I collect and send to her. And most of them she never would have had on hand. And it's parents like this who depend on Real Hope for Haiti. I mean, can you imagine leaving your child and returning back to home because you have to, because you have other children, and not knowing if your child's going to be alive or not in 3 months and waiting for a phone call? And when we have the supplies, it changes lives, it keeps families together. But without our collaboration and our partnership and all of us working towards the same goal, and each one of us role is as important as the other, none of us could do what we're doing with these favorable outcomes.
Amazing. I love hearing that. Absolutely love hearing that.
Wow, that's a way to start a day, hearing that and the encouragement. And I can't thank you both enough for today, but then also just the long partnership that we have, and how this teamwork, we can just change lives, save lives, and it makes what we do every day worthwhile. So
Yeah.